Patrick, CEO of Life 365, and welcome to Season 2, Episode 9 of The New Normal. Today, we'll be talking about the whole person solution, personalization and engagement of individualized healthcare. Before I introduce our panelists, I want to take a minute and thank all the healthcare providers, first responders, school teachers, family caregivers, vaccinators, and many others helping us through the current COVID-19 pandemic. Thank you for all your service. I also want to let you know that everyone will be on mute and that we'll accept questions via chat, and we'll try to entertain a few questions throughout the webinar. Today's webinar will be posted on life365.health website or the newnormal.buzz tomorrow, along with the audio being available on Apple, Amazon, Google Podcasts, and many of your favorite podcast sites. Now I want to take a minute and introduce our distinguished panelists. First is Patrick Burke, Head of Healthcare for Happify Health. Patrick leads the healthcare segment for Happify. His primary focus is to bring Happify's world-class digital mental health and well-being platform to employers and health plans who share our passion for improving emotional health so that their organizations can excel. Happify's evidence-based activities and games remove stigma, address the challenges of stress, anxiety, and depressive symptoms, and build resilience in order to reduce their impact on productivity and health. Patrick joined Happify after over 25 years with Aon Hewitt because of his firm belief that digital health innovation plays a pivotal role in helping employers improve the total well-being of their workforce, financially, physically, and emotionally. He believes in Happify's aim to address the root cause of behavior change. Happify Health helps employees overcome stigma, cost, and access barriers to deliver sustained behavioral change. Patrick enjoys working with clients across their broad HR needs, from leadership development and cultural change through support for mental and physical conditions. Welcome, Patrick.
Thank you.
John Stamatopoulos is the Senior Vice President of Payor Strategy for Happify Health. John is leads the business unit that deploys the Connect platform for digital therapeutics and care delivery, designed to improve mental and physical health. He has led multiple medical device and digital health startups, most recently as the president, COO of Empathetics. He has also served as commercial leader at Innovalon and Valentis. John attended business school at Northeastern University and volunteers within the community as a board member and coach. He is active in Digital Therapeutics Alliance, AvdaMed, and the Alliance on Aging. Northeastern University Health Systems entrepreneurs and a mentor to international healthcare technology. And welcome, John.
Thanks for having me. Appreciate it.
Great. And the last person is Mario Vassaux, COO and CTO of Life 365. Mario is a technology innovator with over 35 years of business operational and technology development experience. He has launched and operated successful software, hardware, technology companies involved in a range of products, including video games and medical software. Mario has participated in the publishing and development of multiple PC, console, and mobile video games, including hits Duke Nukem 3D and Wolfenstein. He has developed a diverse range of award-winning apps and mobile games for business, consumer education, cybersecurity, and a suite of medical apps with Avicenna Population Healthcare Solutions. Mario combines his experience with gaming and medical software to develop innovative solutions that create better connections between caregivers and patients in order to improve patient care and outcomes. And welcome, Mario.
Thank you very much.
Okay, so let's get into it. The recent pandemic has acted as a catalyst to accelerate the disruption in how healthcare is delivered and consumed. Quickly transitioning to a consumer-directed, people-centric approach has caused organizations to scramble to move away from just delivering point solutions to meeting the demands of individual consumers in a targeted, personalized manner. I want what I want when I want it. Consumers and payers will drive the changes in healthcare going forward. Payers want to be able to offer their members a variety of bundle solutions that are properly aligned and personalized to individual members' needs. Life 365 obviously embraces these values, but I also have been fascinated with one company that I think is like-minded and going the right direction. And I have them on our panel today with us, and that's Patrick and John from Happify Health. So Patrick, I want to, take this opportunity to welcome you, but I also want to ask you the first question was, where did Happify Health start? What was the core product offering that the company initially offered?
Hi, Ken. Thank you again for having John and me today. So Happify was founded over 9 years ago. Our co-founders had built and scaled a very successful casual gaming company. Think of the genre of like an Angry Birds or that genre of game. So they really understood the science of getting people deeply engaged in something that was fun, joyful, if not. It wasn't the legacy they wanted to leave, though. And so they said, well, we understand the science of engagement based on how we can deploy these games. And so they focused on healthcare. And they met up with a few of now our core management team. Acacia Parks, our chief scientist, she was at Penn, and she was a PhD who's studying the impact of clinically effective behaviors on anxiety and depression delivered through software technology. Like, can you gamify things? So that and a few other folks is where Happify began. It's like, how can we bring this to healthcare, bringing the science of engagement and then the science of clinical activities that for decades, whether it's cognitive behavioral therapy, positive psychology, or 6 other modalities that were peer-reviewed, published and peer-reviewed, digitizing those clinically proven activities was a way to actually address their highest aim was, let's tackle what we now consider the meta condition, but starting with anxiety and depression, right? So destigmatizing it, engaging people, and we grew up as a direct-to-consumer company. So download the App Store. We had 4 million users around the world. We're in 10 languages. So starting there was just making an impact. So being able to A/B test both engagement and content, and then all of a sudden it was like the healthcare. So our first approach was from a very large self-insured employer and also health plans. They're saying, you know what, people are coming to us. How can you take this and how can we then help people? Because we can help people at scale. And so then we invested around it, Ken, and we built what is now our digital first enterprise platform, which marries up that wonderful digital therapeutic, so that self-care application, but marries it with activation so that you can do outreach. And then you're marrying up activation and engagement, and then we've been able to just invest around it, which includes how they can measure the impact and reporting. So that's sort of our journey as a way to kind of now inform what a whole person, how can you help a whole person? Our belief is you start though with addressing their mental health, and it has a wonderful impact on things like the chronic illnesses related to knowing that anxiety and depression are really comorbid with those. So I hope that helps, but that's our origin story.
So you actually gave me a lot of information there to unpack, as we go through the new normal today, and some new terms as well. But Mario, I saw you shaking your head, and agreeing with, Patrick from this. What part of what Patrick says resonates with you as far as gamification and patient engagement?
Well, the reality is that games in general, casual games specifically, have a formula for attracting people to the games, but more importantly, to keep them engaged in the games and playing over and over and over. Something that to many of us, seems routine, but it's actually addicting. And being able to apply that to a personalized healthcare to the patient is fantastic, because here's a way where now you get them where they're playing, right? that kind of thing. But now you're actually doing it for something other than leisure. You're now impacting their lives, possibly by helping them create better outcomes for themselves.
What's interesting is, what inspired me about starting Light 365 and then bringing Mario agreeing to join us, along the way from this, is I learned from life. I learned from dealing with my own mother and my own father and how they engage right, in their healthcare. My mom was, was incredibly sick with a lot of different, she was comorbid with multiple disease states. She wanted to play on her tablet as much as possible. She knew how to game the system actually to be able to fudge the numbers and do other things with them. And part of our inspiration is like, how can we keep my mother engaged in her care? My father was off the grid, a different persona. My mom was on the grid. How can we keep her engaged? Maybe even engaged with a cohort and play against other people or friends or families and swap things. And if she wanted to cheat and game, that's okay, because cheating is part of engagement, right? That she's engaged with the system. And that's where I kind of went ahead with this as well. You guys are heading already there, is using multiple different platforms to be able to engage people and keep them, going on a regular basis. She would have loved it, right? To play a game all day long. And why you had her, if you could go through and teach her a teachable moment along the way, that would be beneficial, right? And as well. So John, one of the questions I had was, from a payer perspective or just from a commercialization perspective, how does a payer, or how do you approach a payer with, are you walking with a single solution? Are you walking in saying, give me your first 10,000, patients that are frequent flyers? How do you engage with that population and ultimately get Happify in the hands or on the phone of those 4 million users that are out there?
Yeah, and just to clarify, those 4 million users were folks that on a direct-to-consumer side came to us on the App Store, right? So that's
Okay.
a pivotal point where our founders said, okay, we have folks by the millions that are incredibly engaged. If we can now introduce this company in a healthcare setting to help people invest this type of time and attention to an area that will make them happier, healthier, drive positive behavior change, those benefits will benefit a self-insured employer, a health plan. So that was really the momentum that brought us into the payers space. And so historically, we were known as Happify, as the app, right? That's how I became such a fan and a proponent of the organization.
And that was a direct-to-consumer app. The consumers were paying for it. Was it free? How was it monetized?
Correct. There's both. There was a freemium version. There's a direct-to-consumer version that was paid on by individuals on the App Store. And now we take a much different approach within employers and health plans. They're the one now who engage with us directly to provide this offering and benefit to their employees and their members. So when we approach a health plan, it's really quite eye-opening because they've invested in a lot of solutions across mental and physical conditions over the past 5-10 years, and they continue to every day without really having any type of insight into if an individual is having success, if they stop using it, why? Are they better? Was it not the right one? Did they move to a more intense level of care? So when we approach them, yes, of course, we still have our portfolio of digital therapeutics and interventions, but the approach we take with them now is we come in and provide an ecosystem. And where this is so attractive to them is we're able to take that individual, get them up front, activate, assess, triage, and navigate them to the right solution that's right for them. So when we tell this story to a health plan, their eyes open right up because they have a lot of solutions that they don't know if they're effective because they can't get people to them. They're really hard.
So give me some numbers, John. Give me some numbers of what opens their eyes up, right from that. Is just
here's the number. So historically, they know that 30% of their individuals have some type of a condition or prior diagnosis within a behavioral health area or mental health need. We're really good at activating and engaging that 70% who don't raise their hands for a variety of reasons, right? Stigma, cost, lack of access to care, lack of awareness that there's help or that they need help. So in an employer, for example, in the 30 to 40% of those individuals, we can activate and engage and keep them at 50% engagement at year 2. So that's the level of activation and engagement we're bringing in. So when we come in now and show a plan that we can reach your hard to reach members, raise their awareness that there's an offering, but provide the insights to a plan based on the individual's assessment, the conditions they're managing, their preferred modality of care, and the resources available to them, and navigate them either to self-directed solutions, to AI or human coaching, telemedicine, or an in-network provider. We now help them optimize their entire ecosystem of resources that they have been trying to do for years. And we bring them the relief that's much needed.
That's awesome. So Patrick, John just talked about telemedicine. You know, one of the things that, you know, why I want to go through on this as well. So you guys evolved into, you know, gaming and targeting more the behavioral health side of this. How do you actually go through and bring the whole person solution together? What other solutions? Well, maybe, you know, maybe I'll start with, I want a definition from you of what you consider the whole person solution to truly mean. What does that mean to you and Happify?
Well, we put the individual member at the center of it. And I know a lot of people claim that, and you, I think, Kent, have made reference to personalization and, like, you know, in terms of how we all want to, frankly, every part of our lives right now, we want personalized, whether it's streaming a movie, buying something online, or even as you go to the store, you'd love to have, you know, your local Target almost identify you as walk in and start throwing your products. I mean, it's starting to become part of the whole mindset that we have. So when we think about what that means to the individual member, John mentioned ecosystem. So let's talk for a minute about how complicated it is for any one of us in healthcare. It's not well intended, but healthcare itself is complicated. But at least we have primary care. There's someone that we can, if we can access them, there's someone to help us broker maybe more specialty. When we look at behavioral health, it's woefully fragmented, more so than that. And so we think about that individual who's got to access their care. And so John mentioned ecosystem. So we've taken a digital first approach, which means we want to get into the hands of that member something that'll help them on a self-care basis. So we'll activate them to make sure that they can do that, but also be able to triage, go somewhere, be screened, have it be relevant in their lives. That's our approach on digital first. Means we take a very open architecture approach. There's a lot, you mentioned telehealth. Telehealth has a wonderful, it's made a huge impact in access to care across healthcare, including behavioral health. It is also a closed system still. It's network-based, right? We've heard time and again from our payer clients are like, please don't show up like so many companies do and tell me you're going to do something that I have to replace something big I've already invested in. If you could add something that helps us optimize, as John was saying, the investments we've already made, give us data. So when we talk about the approach to the whole person, that's the lens through which we want to deliver our services to our clients, but also to the member, so that it is actually engaging and joyful, but it's actually insightful. And like you talked about your mom, you learn a lot if you can deliver content in a way that's engaging. And we can do that on mental health. We can also, as a digital therapeutics company, do that on condition-based, multiple sclerosis, psoriasis. Because at the end of the day, that's the context that the healthcare system has a difficult time delivering. Because like your mom with multiple conditions, how do you deliver that help to people when they have complex needs? So we really try to laser focus there anyway on that member and do all we can to simplify their journey. We call that care delivery, but also deliver them care, which is how we deliver the digital therapeutic.
Yeah, well, I'm gonna direct this question to you and John, but I really want to go to Mario first. You know, Mario, I know we've done some thinking around, you know, how do you do an initial assessment, not only of the population, but of the individual? Because I assume you've got to know about the individual first, right, to be able to understand what you need to personalize for them to be able to meet their needs, right? So you've done some thinking around this.
Yeah, so I have a thing I use, I call it PEER, P-E-E-R, and it's really about engagement, right? So first of all, you need to make it P for personal, right? You have to make it that it's about them, their conditions, their situation. And to do that, you have to do an assessment, right? So, you know, we can use the Avicenna surveys to basically do a quick assessment to get a general idea. The first B is empathy. You know, in any product or a game, there's got to be some empathy to their condition. Once you know what their condition is, you need to be able to talk about it, to give other people's experiences, and you know, things are going to be good, right? Kind of thing. The third one is it's got to be entertaining. You've got to get their attention, and entertainment is part of this. The third E is what I call emotional. There's got to be, once they're there, it's got to be part of their daily lives, and part of getting that is that there's an emotional bond between characters in a game or the topic. You know, it doesn't have to be a game. It could be it's just a mechanism. And then R is really, it's about results. People want to be able to see results, and you know, people don't use apps and things if they're not going to get results. So these are that's what my formula for engagement is peer. You know, these are the things that I think will help and make any product, be it a game, be it an app, whatever, engaging, and specifically as it evolves around healthcare.
So Mario, I'll stick with you just for a second. You know, the statistic that's out there, and I haven't checked it over the last 6 months or a year, but says that, you know, there's 500,000 healthcare apps that are in the Apple Store. They get downloaded once and they get never used again, right? From that standpoint, is it because they're disparate? Is it because they don't meet a specific need? Why is that? So how do you measure results then, right? Obviously, a download is not a measurement of a good result, right? That's out there.
Well, I think this is what John and Patrick were saying. So Happify is a one-stop location. They don't have to a window shop for apps, right? For different things. They basically can have a good collection of things. I think the reasons apps fail in the App Store is because our attention span is all about 10 minutes. And again, if you don't have peer, right, you're not going to have engagement. You're going to lose those people in those first 10 minutes. The apps that are successful, again, Angry Birds, or you know, any of the puzzle games that are out there, for example, Solitaire is a good example. Their longevity and their customer base is because they have engagement, right? And so, again, any product that's out there right now, their chances of survival are slim to none if they don't have these this engagement.
You know, Mario.
Yeah, go ahead, Patrick.
I was just gonna, you know, your peer framework is outstanding because it is essentially the gist of what we all want in our experiences, right? And Kent, when you think about healthcare generally, mental health specifically, when we think about content from either of those two parts of healthcare, we think of serious and clinical and often lengthy. Whether you're getting a sheet from a doc that you got to read through to make sure you're going to practice your physical therapy at home, or you even mentioned to your primary care person that COVID's got you down. You're going to be given an instrument typically to assess you. That whole feel is opposite of peer, right, Mario, based on what you said. So from our humble view, I mean, we're one of those 500. Actually, I think, Ken, it's up to 700 now. As of like a month and a half ago, I don't know, exponentially, it seems that it's happening. But in our view is when you bring and marry up the science, you bring science and you bring content and context. It's how we've been able to, at least humbly on the subject of mental health, right, into physical health, is being able to destigmatize it. You know, it's a great takeaway for me today, Mario, on the peer frame, because in so many ways, that's how you design the experience. You know, 97% of people who do our onboarding assessment, just to kind of the start engagement, they complete it. Right. It's a testament to the first touch point of the second touch point. First is to get them to even download it. So context matters. Can you make certain topics in healthcare friendly? Can you make the subject of MS, which is super scary. I mean, any one of us who've been diagnosed with something, or one of our family members whom we love, is what's that first feeling we get? Is that angst, anxiety. And if we can normalize anything coming out of COVID, is our mental health is not something to get over, right? It's just like any other part of health, is something we practice. And so much that, and one of the reasons why we can work across mental health and its comorbidity to physical health is because that access point is the human, right? Yeah. If it can be trusted, context, friendly, engaging, then they'll use it. Mm-hmm. And as a content, we work with experts to develop the content, whether it's clinical content for a physical condition, or with an employer working around how do we make sure we help managers work through the stresses of return to work, in the COVID world. It's about delivering contextualized content so that the activities, those clinical activities, you'll practice them, you'll work on them, you'll build skills.
You just gave me a thought. It's really, as in games, you have to give the user a reason to continue, a light at the end of the tunnel. And in a way, being able to give them, so, you complete a game level, right? Or you complete a process, you do a survey. One of the things I was thinking is there are so many apps that, this is to Kent's questions, apps that basically you have to go all the way through to get a result. And the fact of the matter is you have to give some sort of stimulus every step of the way so that it motivates them to move forward. And I think that's really what's lacking in healthcare apps, is that everybody decided, I'm going to create a healthcare app, and at the end of the day, they put you through a process, and if you go through it and you get to the end, you're going like, oh, now what do I do? What do I do with this information? What resources are available? And I think that's part of this whole engagement piece, is really keep them going, keep them motivated, and not, I think unfortunately with healthcare, especially mental health, behavioral health, that you mentioned something really important. It's destigmatize it. Make it something that you can have a conversation with. Even though you're talking to an app, you got to make it personal. You got to make it sound like you're actually talking to a therapist or a psychologist or somebody that can help you out. And I think that's where the huge disconnects from the digital world to the real world is, right? It's that personalization.
John, I was going to mention something to you really quickly. The healthcare system, and this ties into the whole conversation that these guys just had, is very much about point solutions, right? That they're, I'm going to talk space. I'm just going to talk to you about your, behavioral health issues out there. But if they come to me, I may have a behavioral health issue, but I also might have a heart issue. I might have sleep apnea issue. I may have social determinants of health issues. Here, I'm giving away all my secrets now. Everything that's out there. But, do I have to have 4 different apps and 4 different companies, right, to be able to solve my issues that are out there? How do we make Happify be on the front page of the phone, right? Both for the caregivers, but also for the individual that's out there as well. So they turn to it on a regular basis to kind of solve their needs. I mean, how is Happify addressing that?
Yeah. And what you touched on is also, you may have 4 different apps, and your doctor and your health plan may not know about any of them, right? So how do we get you engaged by something that's clinically validated, where we know that data is actually turning into insights where someone can provide you the care you need, or empower you to self-direct the care you need. So when we come in and we take an assessment and capture a profile of this individual and create what's called a life graph, we take all that into consideration, right? So we get a pulse on what are the conditions an individual is managing, what is their employment status, what is their relationship status, what stage of their life are they in, and the ability for us to capture data on an individual and personalize it. Someone touched on a moment ago where it needs to sound like you're interacting with a therapist. For us, what we've realized is technology, we're observing individuals be much more open and honest with our apps and our search bars and our digital therapeutics. As we see, Dr. Amazon and Dr. Alexa and Dr. Siri, they are the front door for most people right now, right? That's where they're asking their first question. So folks are very willing to be open, honest, and curious with technology. And what we're doing is capturing that profile and just allowing health plans and providers to be proactive versus reactive and episodic. So we can understand that someone has a housing insecurity or food insecurity or just went through a divorce that may have triggered their depression and anxiety. And it's 9 months before they can sit with a psychiatrist or a therapist, and we can empower them with the solution to self-manage their care in the interim till they get to a more severe level of care. We are now changing that, right? We're being proactive. We're being the right modality of care at the right time. And we're seeing just incredible outcomes, both clinical and financial, tied to that, because we're reducing the price of encounters. We're getting people to a different encounter faster. And we're able to watch that journey to see all of those other investments a health plan has made. They can see if the individuals are transitioning to different levels of care. They can see if they're capitalizing all the resources they're making available to their members. Or on the provider side, they can now have confidence that there is something guiding and caring for their individual, I'll call them consumer instead of patient, their individual consumer, when they're not sitting in the four walls of their practice, right? But the ability to monitor, whether it's through RPM or RTM, the ability to monitor that individual along their journey and capture insights to see maybe they need an adjustment to their medication or they need an intervention sooner versus their 90-day scheduled visit for an A1C. This is all insights that will just transform the level of care we can provide to an individual. And we're really happy to be on the forefront of that. And we continue to, to expand those capabilities every day.
Yeah. So Patrick, how do you engage the support system around? I recently, I'm open with my stuff. I recently went on Noom to try Noom. I like Noom, from a standpoint because it's engaging with me, helps me with my journey, does some coaching. It can be better from an AI perspective and be a little bit more personalized. But you know what really helped a lot is my wife started it at the same time too, right? So there was that support system around it that just kicked. In fact, she started before I did, and then I kicked in after that. What tools do you build for the caregivers and for the families, to kind of support, the person in their journey, the individual in their journey?
Well, a couple of things, Kent. First is in increasing the majority of our deployments, we're deploying for the whole family or the household, so that nothing does foster better care, self-care, when you've got somebody in your household, maybe on a similar journey, might be unique. So yours and your wife's experience. But I think I would come back to, what does support the caregiver? What supports that other is actually being able to also support through content. Example, we have over 74-week tracks. And those are programs that people work through. We keep it bite-sized activities. We have a lot of tracks in the context of a caregiver. Well, it can be in a relationship. It can also be in the caregiver for an elderly parent, in caregiver for someone with a chronic illness, because that contextualization, again, helps personalize it. Because the more it feels like you're understanding me, that I might be doing activities that are very similar to my loved one, but the context of why I'm doing them, I might be frustrated or scared that my partner is sick with something, cancer or other. And I can attend to those while my partner might be doing something that's based on stress at work. But the point is, like, in our world, that's how, we're attending to the individual. We do a lot of patient research, and we do that holistically with the actual person with the condition, a caregiver, and clinical. And what we hear time and again is how almost all the focus in that context is around the condition. And the majority said, we still have relationship issues. We still have financial worries. So thank you for helping us kind of attend to these other things that are outside of the fact that I have this chronic condition. So those are a few of the ways that Happify, it's very dynamic, right? So it really is driven by the individual. So you and your wife would be able to choose your own journey, if you will, in the context of how Happify is deployed in the average household.
One of the things that you said earlier on, I think it kind of resonated with me, is I think we kind of do the same thing, is we do not have an invented here mentality. And I don't think in today's age, especially with healthcare as fast as it's going, that you can have an invented here mentality. So, Mario, I'm going to go to you really quickly. What are the things, go on a platform that you consider being more of a whole person solution? And how would you, leverage partners to be able to, to provide that functionality?
Uh, there are so many things that can be done. I think really the ability to do the assessments up front really is really key, because what you don't know, you can't treat what you don't know, right? You cannot provide the proper services that are needed. So I would start there, and again, how you get that information through surveys. You could actually do it through a game. You can do it through person-to-person communications, through social media, whatever it might take. That's something that you would look at. Further down, though, down the road is how you deliver or collect data, right? And being able to collect data, be it by biometrics through the Life 365 kits and devices that are basically sending biometric data back to the care providers. That is something that's key to the whole person solution, right? So you've got the social aspects, you have the person's the survey you've taken on the assessment you've done, but now you've got some empirical data, which is the digital data that's coming through. Now the care provider, the system, through perhaps AI, can actually now make an educated assessment of what that condition is. And I think most of our fears as probably one-time patients or another is called uncertainty, right? Our fears are built on uncertainty. If you can narrow that down, I think whatever tools are necessary to narrow that down are key to success, successful outcomes, and potentially for us, a successful product.
Right. So John, really quickly, from a Happify perspective, that connective tissue, right, that is out there between partners. How do you leverage, partners that are there so you don't invent it yourself? You've got a behavioral health core that's out there, but if you want to go into social determinants of health, or you want to go into transportation, or med reconciliation, or chronic conditions that are out there, what things do you see adding to your platform, and how do you have the connective tissue to leverage that existing ecosystem, not walking in to a health insurance plan and saying, you guys already use script drops, so we're going to use something else, right? That's out there instead. How do you leverage that ecosystem?
And thanks for letting me handle this question. So for us, we are against the it's invented here mentality, right? We are partner agnostic, meaning we know what we're best in the world at. And we know that if we can combine efforts with other folks that are world-class, we can become an incredibly powerful solution for a health plan. But we also know it's really hard to displace a solution that a health plan or an employer has already spent a tremendous amount of financial resources and time and effort deploying. So we can come in and bring sophistication to a plan and be collaborative and willing to help advance their other solutions as well, or drive insights to them from their other solutions. That's incredibly, that's interesting to them, for the fact that we're not looking to displace anyone. We're actually looking to come in and enhance everyone. So that has afforded us incredible opportunities in our current sales channels. But for us, that's on the customer facing side. For us internally, we know there's a lot of technology providers and partners out there that may not have been healthcare specific, but just powerful cloud services and data services that we can empower to help on our tech stack and our back end to just truly optimize everything we do. So we look at the ability to start to integrate with partners in the back of the house, as well as solutions that our partners or clients have invested in, to just bolt these platforms together to create insights and actionable information that just could not exist in a standalone. So we're incredibly willing to collaborate, and that's part of what makes us who we are.
Yeah, it's been one of my theses for a while that health systems and large self-insured employers and payers, especially the payers, they'll go out with a disparate solution, maybe a diabetic solution will approach them, and then they'll go, you guys did great, but we want more, right? Can you bring more, especially the Med Advantage side of the plan? Can you bring more to us? Can you serve and bundle this around, a central solution? We don't want to deal with 100 vendors. We want to deal with 10, right? Instead, that are core values from that. So do you see the vendors, sorry, not the vendors, the payers as being willing to sit down and work with you and say, Happify, answers 75% of our need, but we've got another 25 that's not being met, and you guys will work and try to customize the solution with them?
Yeah.
Sorry, I was just going to tell the story of our March launch, John, if that's okay with you.
Please do. Yeah.
We're in market kind of with a very significant use case that highlights that, Ken. We've designed a behavioral health journey. I mean, we've talked about ecosystem a lot. Healthcare is a federation of smaller ecosystems. So even selling a health plan will be your ecosystem, provider, is they roll their eyes. No, good luck with that, right? Is what they would say. So what we launched in March was for a behavioral health solution, and we're able to activate. We can assess and triage, and we're basically open to the entire household. And what we're doing essentially is, as we're going through that onboarding assessment, is we're contextualizing the content as well as where they'll triage to. And it's integrated with Talkspace, iPrevail, this health plan's internal advocacy team. Their content was digitized. So it's a configuration of what they want that journey to be. And Happify is we're thrilled to be part of this. We're just a part of the ecosystem, that journey ecosystem, if you will. Does that make sense?
It does. So where does the digital therapeutic come in, right? From that side of the equation. I know you guys have gone into digital therapeutics. Just kind of explain that to me a little bit.
Two quick things on that. First and foremost, the app that you described, we've talked about, is a digital therapeutic. It happens to be a population level, right? So it is software as a medical device grade. So grade, if you think about what the FDA cares about. But we also have an entire part of our business that is prescribed digital therapy. So it's condition specific, that we're going through FDA approval so that it can be prescribed. But you asked early in our conversation about the platform approach. At Happify, it's the same platform, delivering that digital therapeutic that I described for you, that a health plan member gets. But the potency, if you will, of what we're doing on the prescribed digital therapy, how it's designed for that context, it has the same foundational efficacy. Right?
Why don't you describe for me really quickly, or to the audience really quickly, your definition of a digital therapeutic, and using it in context with Happify, right from that, or the FDA's definition of a digital therapeutic.
So the FDA, basically, it's first and foremost, it'll be considered software as a medical device. So we understand physical medical devices, those things that we get, and they're given to us, and we can get reimbursed through claims. And so the standard for that first level is really to make sure that the claims that you're making are really governed around helping people manage certain conditions in their lives. The simplest way to think about a digital therapeutic, again, software as medicine, is when it's prescribed, it is actually able to treat. I'll give you an example. Multiple sclerosis, a use case that we have partnered with a pharmaceutical company on. We deployed our DTX as is. It wasn't even tailored for someone with MS. We saw healthy improvements in anxiety and depression, sort of our wheelhouse. We also saw a 17% reduction in fatigue. So it's an endpoint that the actual drug itself could not move the needle on. And that is the space where John and I just feel blessed to be able to work, is like bringing that as either a combination therapy prescribed, or over time, there are certain conditions where you can prescribe the software as the treatment. Does it help?
Ken, if I
Anything I'd miss on that?
No, you nailed it. And so here's what really shows the breadth of Happify's offering, right? When you look at digital therapeutics, there's three categories, right? There's the ones where the app is the intervention, and that we have a business unit that focuses on delivering that. There's the second category is where the app is a companion software to a drug or device to support a particular condition. And we have a business unit that, again, same business unit handles that. And then the third is where the app manages the behaviors that help control a condition. And we have that within our app as well. So three very different modalities, but we're blessed to offer them all across a variety of conditions and needs. So some of those will be FDA cleared and prescription only. And others are digital therapeutics that are considered OTC or accessible to anyone without a provider being in.
Right. And the gamification part of it, is, just part of the engagement as part of that app, right, to do. So, the gamification, just walk me through that really quickly. What level is the gamification from that? Is it a personal experience? Too bad we can't do a demo, from this. Does it walk them through the whole journey of, days and days and days of educational content? How does the app work?
So Mario will keep us honest here, but for decades, my prior life, talking about gamification, so actually creating engaging experience where there's intrinsic motivation to do things.
By the way, he doesn't like me to use the term gamification. It really is patient engagement with utilizing games, right, from that perspective.
Mario, we would be so aligned on that, by the way. Thank you so much. Because after so many years of the concept of being talked about and yet not seeing impact, one of the reasons I fell in love with Happify and I came here is because every part of the experience is designed with that marriage of the gaming expertise and engagement and the science of these clinical behavioral change modalities, which means that from the very first time someone sees a digital property, they're going to see, do you want to conquer negative thoughts? They don't want to say, do you want to work on your anxiety? Yeah. And then through the experience, the look and feel of that onboarding assessment was designed like a game would be. It's quick radio buttons. And then the experience is you're designed to take action. Big button to say, I'll start my track. If you want to learn more, we kind of reveal more content based on your curiosity instead of, let's give you 3 pages to read about cognitive behavioral therapy before you do anything. So then when you do an activity and you complete something, it can be an all-out game. There's a balloon game where you can actually, you're reframing your negative thoughts, but you're basically just bursting balloons, or you're touching and earning points. You're earning medals and points. And at the end, we're going to ask you on a smiley face range, how did you enjoy it? Because if you didn't, as you normally have like some feedback loop, then we're going to not serve that activity up for you again.
Exactly. I was going to say, by the way, I don't want, sorry, Mario, but by the way, I don't want you to flip up a page and give me 3 pages of explaining what cognitive behavioral therapy is. I want to just play the game, right? I just want you to teach me, right? Teach me through lessons or whatever else that's out there to reinforce what cognitive behavioral therapy is from that, and kind of answering and being interactive back and forth. I don't like, just reading stuff. Mario, I'm sorry to interrupt you.
No, I'm exactly on the same page as you guys are, because the reality is, the word gamification has been bastardized because it's been used to add, hey, we're going to make this fun and entertaining. But the reality is what we're looking at is really the game mechanisms, right? The inner workings of how you create engagement, how you create repeat play, all of those. That's one side of it. And then the other thing is really once you start getting into the actual, where you're actually playing a physical game, but not only to play that physical game, because the reality is the next level is going to be when you're playing a game and you're actually doing an assessment based on how you play that game, right? And being able to then come up with formulas, algorithms, AI that are going to go saying, hey, you're depressed. There's issues here, or you're doing much better, or, something like that. That's the next level of where, if you want to use the term gamification, then you can use that. But the reality is, it is engagement.
Hey guys, I'm going to take a checkpoint really quickly. We've got about 6 or 7 minutes left. It goes fast, but I want to go really quickly to, and this probably should have been up front. Your platform, the whole person solution, personalization. How is healthcare failing us right now, right? From how they're delivering healthcare, and we know how you're doing it differently, but what are they going to have to do in the future besides Happify and how healthcare is going to be delivered? Where do you see these $1 trillion channels that are emerging right now, that I call that are the Amazons and Transcarents and the United Healthcares and Amwells and Livongos and all those guys that are out there? They're all going to connect into a patient population. They're not going to share with each other between them, right? From that standpoint, where is this platform play going, right? And how does it have to be put in so consumers are now in the driving seat? What are you going to have to onboard onto that platform to engage consumers going forward?
Well, the deal breaker, all deal breakers, is if you can't get the engagement, you'll never get consent. We know this is coming, to have consent for me to control my own data and tell it where to go. So the holy grail is to get that activation and engagement. Healthcare, no matter which topical area, is to get us to trust that and give over our consent so that we actually can control more of our care. We do see that at Happify is where it's going. We're going to have great control over where our data goes and how my Internet of Things, all the wearables I have. So that's first and foremost. But healthcare, you asked about kind of what's broken, is like the lack of penetration, the care for people. That unless you get that engagement, you can't get them further into care, to get them to actually adopt anything that their doctors and providers are telling them to do. General health integration is probably the other big area. What we're talking about today has a great deal of this connective tissue between the mind and the body. It's the very nature of what you started with. Look at how long it's taken for us to even honor the fact that medical behavioral integration is even important enough to address. And we believe that there's a possibility with software and technology to bridge that gap, so that we are seeing better care for people totally when they have chronic conditions, and hopefully getting them earlier so that maybe they never get those chronic conditions.
Awesome. John, what about your thoughts about what's broken in the healthcare system and what needs to be added onto the platform to engage consumers?
Yeah. Well, for us, what's broken is we are making decisions in a silo, right? So there's tools being deployed that are not being, they're not being activated by individuals. So folks aren't even aware of what resources are available to them for a variety of reasons, right? They're archaic in how they engage folks. Folks live in an area where they just don't have access to care. So when they do see care, it's reactive than emergency. So incentives among doctors, it's all reactive, right? We're not incentivizing them to keep people healthy. We're compensating them when they take care of someone who's presented themselves with an emergency or an illness. So the sooner we can get individuals engaged, give them selections on where they receive their care, how they receive their care, and start to provide them access to tools that keep them healthy to avoid a major injury or illness for advancing. Then there's opportunities. So for us, for our platform, and I say for us, but for any platform, if you can get individuals active and engaged and taking control of their health and giving them choices on where, how, and when they're cared for, then we start to break that cycle of disalignment between people being cared for proactively versus reactively, and incentivization among healthcare providers. And part of that is also allowing folks to practice at the top of their license. So we're now seeing individuals, whether it's NPs or other pharmacists, being empowered to care for people earlier and further upstream.
It's interesting. Mario, your thoughts on what's broken in the healthcare system?
Just two things that I can think of off the top of my head. One is the fact that EHRs have a stranglehold on patient data, right? The fact is that patients should have control of their data. That's one of the big showstoppers in that. The second one is that technology is being used to create efficiencies and more of the assembly line. You know, it's an inch deep and a mile wide versus what we should be using technology for, which is to create better care and a deeper connection with patients. Those are the two major things that come to mind for me.
Yeah, we're going to wrap up here in a second, but I want, Patrick, you're kind of thinking of where, these trillion-dollar channels that are getting created right now, what are they going to look like here in the next probably 5 years or so? What are they replacing? I know they're dipping in and stealing, patients, from health systems and from community-based care, right? From that, putting them on a platform. So, what is your thinking as far as where we're at in the next 5 years? What are we doing with virtual care, and obviously what you're offering as part of virtual care and virtual, I wouldn't say augmented reality on this stuff, but how do you replace that with face-to-face care, right, as well? So I'm packing a lot into that question, but where do you see us migrating to or going to over the next 5 years?
Yeah, I think if everyone on this webinar could just think about what Mario and I have been hinting at, is like, if we can unlock our own data and have trust and security, I think there's a huge focus on our ability to trust, because we're gonna be in a multi-cloud world, right, where our data are everywhere. I think it inspires so much imagination for how healthcare could change by just doing that alone, Kent. And so many things like then telehealth. Then what we're going to see is this interoperability means, I think almost our choices will be today at 4, do I want to just get on a telehealth or do I want to actually go in the office? We're going to be able to choose every modality. And what's going to happen is the commoditization of what is now pretty novel about telehealth, that's just going to become the standard. Like, you can talk to your primary care or any health practitioner multimodal. They'll be available to you in many ways. So anyway, those are a few things that, at least that we think as we're looking at the future.
And really quickly, what is Happify going to do to keep the app on page 1, right, from that, to keep it engaged and keep the consumer coming back?
Well, the intensive focus we have on context and content and relevance. I mean, I go back to you, Mario, on peer. We're going to stay on principle, and we're going to stay interconnecting within our clients' world, employer world, the health plan world, health system world. If we can be that advocate for that member, for that patient, that experience, that engagement and trust layer, I think Happify, you're going to see a lot of Happify in the coming decade.
Awesome. So John, what about the next 10 years or next 5 years from your perspective?
Yeah. Well, perspective here is, I mean, as we ramp up the ecosystem approach, right, you'll see a continued bolt-on and collaboration of platform to platform. And I think the insights will start to be able to generate, whether it's looking at claims data to improve clinical and financial outcomes, but also the data we drive from individuals and the way they utilize care, diagnosis, medication management. I think you're going to see just incredible optimization of medication, patients recruited for clinical trials. I think and we learned a lot of this during the pandemic, we're going to be able to use very broad levels of technology to start to get incredibly personalized with medicine and care management and care delivery, that'll really allow us to accelerate the modality at which people are cared for and the cost of that encounter.
Yeah, I love what you guys talked on, and we're going to wrap up, but I love when you talked about even using alternate sites and alternate resources, like even the pharmacist, right? Getting provider status and starting bringing to rural. Really quickly, I'm going to wrap up with Mario. The next 5 years, Mario, where do you think it's going?
I think the fact that I believe medical data is going to become more personalized. It's going to become more available. I think that all of our efforts are going to be to make that data actionable and create resources that are at the fingertips of consumers, so that they can manage their own health, to a certain degree, and bring in medical assistance when needed, right? Again, I really think that there's got to be an independence created for consumers for how they manage their healthcare.
Well, thanks for everybody, for the panelists for today, but thank you for attending this afternoon. I want to take a minute to thank our distinguished panelists, Patrick Burke and John Stamatopoulos and Mario Vassaux, for your participation and great insights in the whole person solution, personalization and engagement in individualized healthcare. We were able to get through this without having people not getting their questions answered. But the video will be posted tonight on the Life365 Health and newnormal.buzz website, as well as your favorite podcast sites. So please be safe and healthy. We'll be hosting the next edition in 2 weeks on June 23rd at 1 p.m. with the subject is accelerating innovation in a converging healthcare market. Have a great evening, and thanks everybody for attending.
Thank you.
Thanks guys, really appreciate you being here.